Hello, everybody. It's nice to see you all again. This is Andrew DeFranza coming to you from Goat Hill in Beverly, Massachusetts, talking about our Facebook Live for Harborlight Community Partners. This is our second one. Hold up here for you in case you need to know any of this. Harborlight Community Partners, we're your local affordable housing nonprofit on the North Shore. Please check us out on Facebook, on Twitter, on Instagram, or on YouTube. We're happy to have you. Thank you very much. Wanted to get you all an update on what our status was so you knew what was happening and put out some thank yous to express our gratitude. First things we want to do is thank all of the Harborlight Community Partners staff at all of the properties who are really doing an amazing job caring for our residents, especially for our seniors and our formerly homeless residents. Really doing an amazing job. A big thank you to all of you. It's the work you're doing right now is incredible and needed and sacrificial, and we appreciate you all. We also want to thank all of the folks that are working at our properties that, while they're not HCP employees, are certainly partners. So all the home health aides, the kitchen staff, the maintenance people, everybody who's working to support Harborlight Community Partners residents, we see you and we thank you, and we're really grateful. So we want to get you a couple of updates and then give you a little more feedback on some other items. So far, all of our residents are safe. We did have one person that we were aware of that was infected and went through a process at a hospital, was able to come home and quarantine and pass through the quarantine period and is safe. And that so far is the only one that we know of. All of our staff are safe at this point, though we have had quite a number of scares, both with Harborlight staff and partner staff, and a number of people tested and quarantined. But at this point, everybody is safe. We're really grateful for that. We did lose, as many of you heard, one of our longtime board members, Don Kelly, and are grieving that loss still. And on the staff and the resident side, everybody is well. We feel very fortunate, and we're sending our prayers and our wishes to all of the folks that are struggling, that are ill or have family members that are ill, especially our other peers who are providing affordable housing or long-term care settings. So that is the good news. And we are continuing to work hard day by day by day. This is going to take a while yet. So we appreciate all of the residents out there. We appreciate your patience and all of their families, your patience and their encouragement as we try to keep people safe, both the residents and the staff. On the real estate development side, we continue to be on track with renovating a single unit in Gloucester on Haven Terrace. That will be an affordable first-time buyer unit, probably later this summer. That is a small crew, and we're able to continue to do that safely. We also are continuing with 2 Hardy Street in Beverly, which is a small family rental project, 6 units, community scale housing initiative project. That will be done later this summer also, and we're hoping to be able to occupy that in the fall. We're moving ahead with our friends at the YMCA who are hoping to close the Cabot Y refinancing later this summer and go into construction hopefully later this year, depending on the health conditions. But we continue to support them in their efforts. And we're waiting on funding announcements from the state on Anchor Point Phase 1, which is in Beverly, and Granite Street Crossing, which is in Rockport, both of which we hope to hear about later this summer. Maple Woods in Wenham continues to move forward. We have to amend a permit, and there's a meeting for that in late May. We continue to work with the town to advance that, and we hope to submit that to the state for funding late this year. And we are continuing to look at something in Hamilton, as we have discussed, though I cannot give details at this point yet. So a few other things that we would like to give you. We did apply for and receive the PPP money, payroll protection money. Huge shout out and thank you to our friends at Cape Ann Savings Bank who helped us to do that. Local banks, they're key to our community. We need them. And they supported us when we needed it, and we were able to get a small loan from that program that has been deposited this week. So that creates a significant amount of relief for us, and we're really grateful. So what do we need? Where do we need help? What are the ways that you can provide support? We'd like to thank all of the folks who have been helping us provide protective equipment, PPE. We're now using masks, gloves, in cases where we're really concerned, gowns and face shields. So we'd like to thank the following folks. Deacon Giles Distillery in Salem is now making hand sanitizer, and we have had access to that through them, buying hand sanitizer from them. Our friend Gary Maffey, hey Gary, and the remodeling company were able to provide us with some Tyvek suits and shoe covers, which we're using in the event we need that for our maintenance staff. The Massachusetts Emergency Management Authority and the Beverly Emergency Management Authority have been great, contacting us almost every other day related to PPE. I believe we're getting some from them today to help keep residents and staff safe. The Masses Nurses Association provided quite a bit of equipment to us in the last week, and we're really grateful to them. Grateful to our friends at the Cabot for donating sodas for the staff at Harborlight House, who are really working incredibly hard to keep those very frail seniors safe. So we thank you, Casey, Bob, Kim, the others. We really appreciate you all. All of you have been making cloth masks for our residents. My longtime friend, Deanna Fay, my colleague, Kristen Carlson, and the many others who have been doing that. We really appreciate what you're doing in making the masks. The Beverly Rotary Club and the Hamilton Wenham Rotary Club for volunteering to make phone calls and send notes to our isolated elderly residents. We thank you and appreciate what you are doing. All of the children out there who are participating in the HCP Not Alone program, this program here, which you can find on our website. If you want to check it out, these are the kids that are making artwork that we're delivering safely to resident units, so they have something colorful from a local child to put on their refrigerator. We really appreciate all of the families, the kids and the parents who are involved with that. We had a big socially distant, masked applause flash mob yesterday, for the workers at Harborlight House. And just want to thank all of you who came out to do that, the staff of HCP, board members, and friends. A huge thank you to those who continue to create the food supply lines, our friends at Beverly Bootstraps, the Open Door, and Senior Care's Meals on Wheels programs. Thank you for feeding all of the residents safely. And we really want to thank also the many donors who've continued their support for our mission in this recent time, especially those new donors who have come in as mission builders, which is a recurring gift of any amount. We really appreciate that. If you're interested in the Mission Builders program, please take a look at that on our website. We'd be delighted to have you in the family. Couple other updates for you. One is the Community Investment Tax Credit is in. Thank you to the state, the Department of Housing, for those awards. We've had 3 buyers already this year, with the lead buyer being the Institution for Savings, who has been our lead Community Investment Tax Credit investor for many years. We're going to try to sell all of those credits over the next few weeks to help with cash flow. So if you're a CITC buyer and you want to give us a contact, let us know that you want credits. We'll be happy to get those for you at any point. That'd be no problem. So we continue to need PPE. We continue to need pictures in the HCP Not Alone program. We need volunteers who are making phone calls and sending notes to residents. We expect when it gets a little warmer, we're going to try to come up with some more creative ways to break the isolation. So there's possible ways people might be able to volunteer safely, musicians and others who might be able to provide some sort of entertainment to residents at a distance or even from outside. The dominant need we have at the moment, as everyone I think would expect, is funding. If you're in a position where you're looking to invest philanthropically in the local community, please consider investing in Harborlight Community Partners, particularly through the Mission Builder program that I mentioned earlier, where you can set up a recurring gift in any amount. Any amount at all that you choose will be fine. We need to have the cash flow in place so that we can continue to house our seniors and our essential workers. And in order to do that, we need the support of the community. So if you're in a position to do that and you're looking where to place some philanthropic dollars, I'd ask that you would consider placing some of them with us. So a couple of other updates on policy and how we see this affecting affordable housing, the COVID-19 situation at the moment. One, as you may have heard, there is an eviction and moratorium or foreclosure moratorium that was passed at the House and the Senate, and the governor signed at the state level. Good job to all the legislators. We think that's going to go a long way to protect people. There's going to have to be a lot of work done on how then to help people have the income that they need to pay their mortgage and their rent later. But this was a great first step, and we're supportive of that. There are a number of communities that are working on rental assistance programs. Our recommendation is that we would lead with RAFT, which is the state level funding mechanism to support rent, that we'd lead with RAFT, unemployment benefits, and stimulus benefits. Some communities are going further than that through local funding and trying to provide additional support, especially for families between 50% of area median income and 100% of area median income. So we're pursuing a few options locally with local grant funders, with local foundations, and at least with one local community about whether or not we can support those efforts to make sure local residents have the money that they need to pay their rent. So root for us as we're trying to do that. If you have questions about that, let us know. Long term, what does this do? I think this is the interesting part that we wanted to follow up on. Long term, seniors need housing with supportive services that can weather crises like this. That's what we have to have. We knew this before. We know more now. We have an abundance of seniors in our community. It's an aging population. We do not have the affordable housing for seniors that is sufficient to meet the demand, and we certainly don't have it where there are supportive services so that in a crisis like this, if one of your parents was in a setting like one of ours, you would know that they would be supported in the best way that they could be. We have to have affordable senior housing with services. This is good both on the public health side and on the ethics side. So please continue to support both federally through the rejuvenation of the 202 program at HUD and the 515 program at USDA, and at the state level through targeted capital with supportive services for our frail seniors. We have to have this. People who built the communities need to have a place where they can live and be safe, and a place where they can live and be safe even as they might be declining. And long-term care settings are not homes. That's not where people want to be. It's not the safest option. And it's not the most humane option, and there are alternatives. Sometimes you need long-term care and skilled nursing, absolutely. But for the vast bulk of the population who, other than the need for affordable housing, could live in a home setting with services on site, we should provide that. It's more efficient on the tax side, it's more humane for the residents, and we know how to do it as a community and a state, and we should do more of it. Second, the overlap between essential workers and those who need affordable housing is staggering. People who are doing emergency daycare, people who are providing food and picking and supplying food, people that are providing transportation, folks that are delivering food, grocery store workers, all of these folks, people that are doing construction still where it's still possible, and cleaning where it's necessary, and home health aides and certified nurses assistants. We're talking about people that are making $15 an hour more or less. There is nowhere in the state where they can provide market housing for themselves at those rates, and yet we all need them. That's why we're using the word essential. If anything, this crisis has demonstrated how integrated we are as a society and how interdependent we are. We need people who are doing these essential jobs, and they need places to live. So the beauty of this is we have the opportunity now, the opportunity to reset as we come out of this, the opportunity to honor how interconnected we all are by creating more housing all over the state, all 351 communities, more housing for people who perform jobs that are essential, but where they don't make a living wage to support market rate housing. And we need those in every community, and we need those types of units located proximate, close to transit and close to where people live, where they're going to provide services. So if you right now are somebody who is depending on a home health aide or a certified nurse's assistant for yourself or a loved one, you care where that person lives. If you are depending right now on somebody delivering food to your door, you care where they live. If you're dependent right now on grocery clerks who are taking their lives in their hands or risking their lives quite literally to take care of all of us by making sure there's food available, you care where they live because we're all interconnected. We need them to be healthy, so we are healthy. They need us to be healthy, so they can be healthy. And they need to have places they live that they can afford on the wages they earn by providing that essential service to each of us. And that those places need to be close by enough to where they're providing that service. This is an opportunity. It's an opportunity to create better public policy on the health side, better public policy on the economic side, more equity on the racial segregation side, as we think about the overlap between people of color and those who are doing essential services and people who are getting sick at higher rates. We have opportunity to make this better and to make this right so that everybody will be safer and everything will be fairer. To do this, we need a variety of things. Largely in Massachusetts, we need improved zoning. We need it through the state level, through housing choice, and hopefully further action, we need it locally through things like accessory dwelling units. Looking at you, Mayor Driscoll, looking at you. We need accessory dwelling units. We need inclusionary zoning. I'm looking at you, City of Lynn, and all of the communities on the North Shore who are thinking about this who don't have it. We need inclusionary zoning. We need ways to house workers close to where they work and to the people that they serve. We need to have rules in the zoning code that allow these things to get built, and we need to eliminate the obstacles in the places where it is not getting built. This is good public policy in terms of health. It's good public policy in terms of economics, and it's going to be essential to our ability to maintain this interconnectedness. If you were worried about whether an essential worker was going to be able to work to provide services for you, then I'm asking you to be concerned about the opportunity to make sure they have somewhere to live so that the next time something happens, they're available to get to you to be able to provide the service that you need. The short version is we're all dependent on essential workers who cannot afford homes, and we have the opportunity to do better public policy, more fair and equitable society, and to create more health for all of us, not just the people that can afford it. If anything, this virus has shown us that this is not about economics or politics. This is about health. And the virus doesn't care who lives where or why or how they got there. We're all in this interconnected together, and we need to create an economic system and a public health system so that we have the ability to provide the services where they need to be provided. And a huge part of that is the infrastructure that is related to housing that people who do these jobs can afford so that they can be safe and healthy where they are, and then they can be physically close enough to get to us. That means every 351 communities in the state needs to have housing that people can afford who do essential jobs where they don't earn enough income to afford market rate housing. So I'm looking for these silver linings all the time in this. It's hard, right? It's all hard. It is. It's hard for everybody. It's hard for our kids, for our seniors who feel isolated, who miss their friends and their networks. It's hard, but we're looking for ways to be grateful. We're grateful for all of you, for all our supporters, for all our partners and staff. We're looking for ways to think about what are the silver linings. And a huge silver lining here is that we have the opportunity. We have the opportunity to make the situation better as we come out of this. And we're really looking forward to working on that opportunity with all of you in the wider community. We appreciate all that you're doing. Thank you for supporting Harborlight Community Partners. Please check us out online and consider supporting us financially or through volunteer service or through advocacy. You're going to make it. We're all going to make it. We're all connected, and we're going to make it through this. Have a great day and a great weekend. Get some rest. Love your families. Find some joy. Take care. We'll see you next time.